Hello all. Today we are going to see another remedy that is Rockrose, which is also categorized under fear. The Rockrose fear is very much different from the Mimulus and Aspen fear, because this Rockrose fear comes under flight fright reaction. That is extreme panicky situation like in an accident, a sudden illness, where the person loses all his courage and just frozen like an iceberg. His whole system will get frozen. I mean, to come into reality, we need to apply a few drops of Rockrose to him. As you all will be very much familiar with it, like the Rockrose situations. This Rockrose situation is not created by the inside thoughts or like aspen fear of known unknown meaningless, not like that. This is extremely unexpected and created by outside influences, for example earthquakes, a sudden diagnosis of disease like terminal diseases like cancer. Upon hearing that issues, like a patient will get frozen, the person will be like totally loses his courage and he'll be frozen. To bring him back to the reality, we need Rockrose, and Rockrose is also one of the very important remedy in the rescue remedy that that Dr. Batch himself created that one. And also when in the case of sudden illness like heart attack, like brain stroke, at that moment when the patient loses his reality courage, and we can apply until the ambulance comes. At this time of thing, batch remedies will support, but we need to rely on total health care only, I mean other medicines also. And also Rockrose, after coming back to the reality, we need to support the Rockrose affected personality with the other remedies also. The deep panic would have left a patient with a hurting trauma, a deep trauma. To soothe that one, we need to add Star of Bethlehem. And also, Rockrose combines very well with Mimulus or Aspen, depends on the panicky situation. And also Rockrose combines very well with the Scleranthus. If there is a system frozen, for example, is not able to eat, is not able to digest because of that panic, we can add Scleranthus along with it. It will produce a beautiful result. And also and this Rockrose, we should not for example, if a person met with an accident, we should not just directly give him Rockrose. We first have to analyze how the person reacted to that accident, how the person reacted to that illness, how the person, for example, if clematis person has met with the same accident, we he would have responded little late, so the impact will be less. And also this is not a positive point, but the person mindset I am telling. If one person would have reached that situation, he would have exploded because of this high tension. Like that, how what kind of person he, how he reacted to that panicky situation. We need to blend this both and have to decide how much impact it has created to that person. And also Rockrose can be given to a child who woke up at the middle of the night due to panic. At that time, it blends very well with an aspen, and we can give aspen and Rockrose. And also this Rockrose situation doesn't stop, again, as I said, it's depend on normal a situation how the person feels. For someone, stage fright will be very panicky, for others it's just a fear. So for that kind of situation also we can use Rockrose. And also during dentistry, removal of a tooth, few people react very well and become calm if we give mimulus, but other person think that the thought of going to hospital itself will create extreme panic. Even babies who are afraid of the injection, who cry so much when they see that needle coming through them. So for that situation also, we can use Rockrose. So what does this Rockrose tells? Be courageous. Like whatever the hurdles we face, we have God has blessed us immense power and joy to face. I mean immense courage to face that fear. And also Rockrose affects heart and kidney, as we all know that fear affects kidney. And also when we are panicky, we can see our heart gets palpitation and extreme anxiety, so our circulation and heart suffers a lot during that panicky situation. By making this note, I am concluding about Rockrose. Thank you so much.